time, I would like to invite Mr. Ellis from Third Party Opposition and the Minister to speak for the next 20 minutes. Mr. Ellis, are you wanting to combine your time with the Minister? Go ahead.
Thank you, Chair. Minister, thank you very much for being here, staff, colleagues. I can't think of a more important ministry than a ministry that has to do with children, and of course the challenges that the system has faced for a great many of years has certainly been significant. So I certainly actually do wish you all the best in attempting to make some positive changes to the system, as it pertains to all children that are in care, including that, of course, of those in the Indigenous culture as well. If we could, and I'd like to apologize in advance if I duplicate any of the questions that my colleague from the great constituency, as he likes to say it, is from. But some of these questions are certainly indeed very important. So maybe we can go to child intervention. I think it's fair to say, Minister, that the heartbreaking issues that Human Services face, especially as it pertained to Serenity's case, of course, it shone a huge spotlight on the intervention system, the child intervention system itself. So maybe outcome 2 on page 23, it refers to the child intervention practice framework, which is also key strategy 2.1. What stage are you at for implementing the child intervention practice framework?
Thanks for that. So certainly there has been tremendous work done with staff right across the ministry and right across child intervention to ensure they have awareness of the practice framework. And certainly there have been promising outcomes in terms of the implementation of that to date. A new framework and the practice changes that come with it was actually a substantial culture change within child intervention, and so I'm certainly proud of the work that I'm seeing coming from workers. I think there's more to be done to ensure consistency across the board with that, but certainly there's an awareness of it. People are using the tools, and more we're seeing some very positive outcomes coming from those changes.
So culture change, of course, is a significant challenge, but what are other challenges that your department might be facing as you try to reform this system? What are the challenges other than culture?
Certainly that's one of the great questions that we'll be working on and hearing from the panel. Right now are the challenges of the increased downturn and the stresses that put on families in Alberta, including those who are delivering services and are caregivers across this province. Certainly the increased unemployment and life stress with that, the potential for increased family violence that comes with that. Economic downturns are never an easy time for the families in the province. We have some population growth going on, increasingly complex cases as well. So there are a number of challenges, but I think in order for us to see the very best outcomes, we really need to have conversations with those who are in care or have been in care, to those who are caregivers, to our Indigenous partners, to our frontline workers, to talk about what the barriers are for the outcomes we all want to see. We all want to see children in a loving home if they can be, but most importantly, we all want to make sure that Alberta's children are in safe and have the supports they need to thrive. So clearly we see not every child having those outcomes in the province, which is, obviously a tragedy and something we're all committed to resolving. And I'm looking forward to seeing the recommendations from the panel as to what we can do to change that going forward.
So you talked about increased stressors, and of course, I think I agree with you. Albertans have stressors that have come at them from various angles, and if we stay also on outcome 2 on page 23, we always ask our frontline workers to do more with less, and And I think that's a pressure that's always put on by any sort of management. Do you have any checks in place to ensure that the frontline workers, they're not, their mental health is being taken care of, that, and if it's maybe even recognized in a line item, that would be awesome as well, because, they're facing significant stress on a daily basis as well.
That would be an HR, right? Okay. So certainly, in terms of line items, it would be incorporated in 2.1 and 2.2. Obviously, caseload is very important to a worker to enable them to be able to provide the very best quality of care to our clients, but also to make sure that they can be healthy as human beings and feel respected and valued and happy about the care that they're able to provide to clients. So with that, a key important piece of that is the workload assessment model that's being used to help measure the workload of frontline workers, and to start looking at approaches for managing that workload, and engaging employees through that process to make sure that we find that right balance. Obviously, we have accountability to, Albertans to make sure that we're spending their dollars wisely. So we need to find that right balance between managing budgetary challenges, but making sure that workers have the support they need to provide the care to children. And so I certainly think the workload management tool is going to be an important part of that going forward.
So the system that you're just referring to, is this also a system that would ensure that, and this goes for any business, I have to say this, would this also ensure that, no cases are slipping through the cracks? Is that what that system is in place for?
So the workload assessment model is specifically looking at how much time cases take, how much time they require, complex versus more simple cases, and just finding that right balance for workers to have an assignment that is appropriate for them and manageable, and is the best use of our resources all the way around. Certainly, we're committed to making sure that workers are accountable in providing the very best care to clients. So we continue to, work with their supervisors to make sure that they're meeting expectations around delivering care.
Thank you, and Minister. So when the file is completed by a frontline worker, and I'm assuming here, please correct me if I'm wrong, that a supervisor would then review this file. Is that correct?
Yeah, so the supervisors work very much in partnership with the caseload workers, and very much they function as a team, because when we talk about these situations that are very much not black and white,
Absolutely.
but are very gray, and require decision making, it makes sense that you have two minds focused on working together to make sure that the best outcome for the children, the actions are taken that would lead to the best outcome for children.
So, if a deficiency is found in a file, what checks are in place, which I guess would include a possible time frame, where the frontline workers, so that's your main point of contact for the person, the people that are in the system, that the file is then returned to? I guess is it all is it all recorded?
Yeah, so I mean, there's an expectation, in modern day professional work that they appropriately document what they're doing. Clearly, there are challenges always with finding that right balance in terms of documentation. So proud of the work we're doing to bring in a new IT system that will offer a tool for workers to be able to record their work in a way that's more intuitive and more timely, going forward. But certainly the supervisor is aware of what's happening with a particular client, as is the manager. The statutory director is also engaged in doing regular quality assurance activities, and ensuring that we do that kind of work to make sure that the general quality across the board is high for Alberta's children.
So, Minister, you had mentioned earlier when we were talking here, we were just talking about the child intervention practice framework. Now, your website indicates that you're accelerating the framework. Maybe you can expand on that regarding the acceleration and the purpose of that acceleration?
The work of the framework is essential for making sure that we provide the kind of wraparound services that help families and children to thrive. And so part of our plan to make life better for Albertans is ensuring that we do the kind of preventative work and early intervention work for the families who need that. And what we're seeing is that the framework is having very positive outcomes. It's the kind of strength-based approach, providing that support to families, building integration with communities that actually is having very positive outcomes. And so certainly it is important that we continue to move forward and make sure that framework is fully implemented consistently across the board in the best interest of Alberta's families.
And when do you anticipate the implementation will be complete? Any time frame on that?
I'm going to assume that you're referring to the business plan at this point in time.
No, yeah, that's right.
And so certainly, again, made reference to the fact that this is about a massive cultural shift. Typically, if you look at these kind of endeavors, the kind of culture change that's required takes many years in terms of having full integration. However, we're doing a substantial amount of training and evaluation and providing support to accelerate the integration of the practice. There's very positive results happening with that, and the kind of change that we're seeing is actually significantly faster than has been seen in other examples of this kind of adoption of a new framework. And so we're very proud of the work that's going on with that and hope to see it continue in that fashion.
Thank you, Minister. And of course, we're still on outcome 2 on page, bless you, page 23.
I completely missed that in the midst of my sneeze.
No. I'm just saying that we're still on the same.
Okay.
Part of your business plan here on outcome 2 on page 23, the child intervention practice framework.
Okay.
But I want to just expand a little bit about what my previous colleague was talking about in regards to the Indigenous community, especially as it refers to cultural sensitivity. And I guess, how will or what is your expectation regarding how that sensitive issue will be addressed in the framework? It's such a critical piece.
Right. Certainly within the framework is about identifying strengths for families, and part of the strengths of families and part of the strengths for children is cultural connection. So within that, we certainly have a number of strategies. One is the cultural understanding framework that will help Children's Services implement a long-term coordinated strategy for the staff within Children's Services. To ensure there's a consistent and coordinated approach to culturally relevant training. And we expect it to address recommendations from the Child Youth Advocate and the Auditor General around enhanced cultural understanding. And that framework will be completed this summer and implementation started within the fall. Having said that, we're not waiting around till the framework has been done. We've been improving staff training around Indigenous culture and history in collaboration with Indigenous communities across the province. And we're doing some pilot training programs to augment and complement current training to increase staff knowledge. Delegation training provided to all new workers now includes 3 days of training related to working with Indigenous communities. And all training is developed collaboratively with Indigenous leaders and communities. And we're refreshing all training to ensure it reflects current leading practice. 2 pilots we're doing. The first is Gently Whispering the Circle Back, aimed at improving staff cultural awareness and understanding, which is an interactive experiential 2-day training session on residential schools. And they've the opportunity to participate in cultural ceremonies and activities with elders, learn about the meaning of the circle process, hear stories of residential school survivors, and it is all guided by an Indigenous trauma specialist. Second pilot is the blanket exercise, which is a half-day activity that engages staff's minds and hearts in the historic and contemporary relationship between Indigenous and non-Indigenous people. That was developed in partnership with the Assembly of First Nations and other Indigenous communities, and certainly the perspective has been very positive in recognition of the fact that staff have to understand the culture of the children that represents such a broad part of the children in our system.
So as you know, we're currently reviewing the Child and Youth Advocate. So the Act. My apologies. And then, just staying on the same lines as cultural sensitivity. I know one of the concerns out of one of the meetings I was at was with the African Canadian community. They wanted to make sure that their cultural sensitivity needs were met as well. So I guess other than the Indigenous community, what steps is your ministry taking to ensure that other cultures, including the African Canadian culture, are being addressed as well?
So certainly, while we have such a large number of Indigenous children in care, we're taking extensive measures to address cultural competency around our understanding our Indigenous children and families. So obviously, the intergenerational trauma is a story that is profound and needs to be heard. But beyond that, there's a recognition again that culture is a key part of children's reality and a strength within families and individuals. So it's an expectation that that staff utilize culture as a strength. For example, there's a cultural partnership, a multicultural partnership in Calgary, in which there is a whole team that's dedicated to understanding various different cultures. They come from all around the world, the team does, and have an understanding of language, but their main job is to help workers understand the culture that child came from, that family is a member for. What does it mean for them and their understanding of what it means to be a parent, of what it means to be a child. For example, in some parts of this world, corporal punishment is an extensive corporal punishment is still acceptable. So for a new family coming here and not having the opportunity to be culturally integrated, that's a huge challenge. So how do we work? How do we understand where they came from? How do we help bridge that gap and help them understand what it means to be children and families here? And so there's great work being done on that.
Thank you, Minister. That's great to hear. If I can just spend the last 2 minutes, and I just want to touch briefly on, again, what my colleague was talking about regarding the childcare, and I guess I'll just refer to page 23 of the business plan, key strategy 1.1, improve access to quality, affordable childcare. And if I can, I'm just trying to get an understanding of where the number 25 comes from. Is there some sort of $25 a day childcare? Is that some data to support that, or like why not 20, why not 30, why not 10? I'm just trying to understand that.
So certainly, as well as I do, there's no, magic a lot of times to figuring these things out. But there is a recognition right now that paying the equivalent of a second mortgage for childcare is completely unacceptable.
Agreed.
And that the government needed to take steps to increase access to high quality, affordable children for Albertans. So certainly we understand the early learning and childcare centres to be pilots in which we can look at how these particular centres are making a difference for the children and families that they're serving. And I certainly look forward to the rigorous evaluation process that will allow us to determine what continued funding or possible expansion of the program might look like. It's again, completely unacceptable that that families cannot afford to even work because childcare is such a cost. Either they can't work or they're putting them in centers that are unlicensed and potentially not as safe. So
And
we
just to
certainly
confirm,
support
you
that.
don't have
going
any
forward.
income testing at this time for your pilot projects?
No, so the pilots are to give us an example of what universal
Chair.
childcare would look like.
Thank you, Minister.
Thank you. I would like to invite Mr. Ellis from third-party opposition and the minister to speak. Mr. Ellis, are you wanting to combine your time with the minister?
Thank you.
Go ahead.
Thank you, Minister. You know, I think that we can agree that you know, anything to do with children is a nonpartisan issue, and you know, I think back to my previous career when a child was at risk, it was you know, all bets were off the table. You know, we could enter the home in order to save a child's life if the situation deemed it necessary. Minister, if I could get you to look at outcome 2 on page 23 of your business plan, and I'll just read it here. Supporting children and youth in need of intervention in order to achieve safety and well-being. Now, Minister, I know there's been much discussion regarding we'll say a proposed bill which has been dubbed Serenity's Law, which it really just ensures that there is a responsibility of citizens and adults to contact the police should a child require the need for intervention. I guess my question is, Minister, will your government be looking to amend the Child, Youth and Family Enhancement Act in regards to this minor but this critical change?
Thanks. Yeah, certainly. Obviously, we all take the safety of Alberta's vulnerable children tremendously seriously, and would expect that the adults in this province would intervene when one of those children is identified to be vulnerable or potentially at risk of neglect and abuse. And so I certainly look forward to hearing the work that comes out of the panel in terms of what changes may be needed legislatively in order to best enhance the outcomes for the safety of Alberta's children.
Yeah, and I mean, I agree that I think we would hope and expect adults to do that, but sadly, in many cases, that certainly is not the case, and I certainly welcome the panel's recommendations going forward as well. Minister, if we can just return back to the childcare, I just got a couple follow-up questions regarding I guess the $25 a day daycare. So that would be outcome 1, page 23, business plan, key strategy 1.1. Maybe you can just help me to understand there. So how will the $25 cap work? Is the government subsidizing the parents or the daycares?
So thanks for that question. The grants are being provided directly to the daycare, and part of the requirement for their proposal to be successful, to be an early learning and childcare center, was that they were able to utilize the grant to ensure that parents only paid $25 a day. So the support's being provided to the early learning and childcare center in part to ensure that they're supported to offer $25 a day daycare, but also to ensure that they increase accessibility, they increase community connection, and deliver the quality childcare with a framework to ensure that we have that early childhood development perspective, and looking forward to seeing the outcomes and impact on the children's well-being in terms of early childhood development in these centers as well.
Thank you. And I'm sorry, I just, and maybe this is strictly a yes or no question, but is there data to support where the determination comes up with this $25? I'm failing to understand, why is it not 20, or why is it not 30, or why is it not 28? Like, is there something to support, or is it just an arbitrary number that just fits nicely. I'm really trying to understand that.
Yeah, so certainly in terms of the supports that we provide to families, how much support is enough? I mean, I would love to be able to offer free daycare to children, but of course there's fiscal challenges as well. So it was certainly seen as an incredible support going forward to complement the other actions we're taking to protect and improve services to Albertans. That for many of these, this is can be half the cost that they were paying before. So happy to provide support to families to increase the affordability of childcare for them. So again, they're not faced with not being able to go back to work or else choosing to provide to enter into a private care arrangement that doesn't take advantage of the licensed care childcare spaces in the province.
And of course, we've seen there's risks with that as well. I agree. Minister, if we can look at page 26 of the business plan forecast, looks like childcare expenses rising from $287 million in 2015-16 to $417 million in 2019-20. I guess my question is, what is that plan based on? And I guess, does it involve the $25 a day childcare across the province?
So obviously our childcare program we consider tremendously important to ensuring that Albertans have access to that quality childcare. We need to continue to maintain the licensing and accreditation programs in this province, as well as continuing to provide subsidy. However, we also committed to pending evaluation of the pilots to expand access to these programs as finances permit. So I'm happily looking forward to being able to continue to enhance access to affordable, quality, accessible childcare in this province.
Is there a plan to phase out the regular daycare system that we have at this time?
So at this point, again, with a pilot program, we're not rebuilding the whole entire system around it. So we'll look forward to seeing the outcomes after a rigorous evaluation of these projects to see what the outcomes are, and following that, we'll decide how to progress from there.
Okay, thank you. If we can just talk a little bit further about the Indigenous collaboration, there are 3 outcomes listed in the business plan for children's services. One of them, of course, highlights the need to improve outcomes for Indigenous children. And key strategy 3.1 is to work with Indigenous community leaders, partners to develop collaborative strategies to help them. The strategy on this, if you could maybe provide a little more specifics in regards to that, if you could please. Collaborative strategies.
Yeah, thanks. Again, coming from Treaty 8 territory and serving a number of Indigenous communities, both Métis settlements as well as First Nations, and a number of people who live on neither, but still identify as Indigenous. I cannot emphasize enough how important it is that we get the relationships right, that we have the kinds of conversations that allow us to identify what the challenges and barriers are right now, and to talk about potential solutions going forward, whether it be in the short term, in terms of what service delivery might look like, but also long term about how we can reduce the number of children in care. And clearly, it's a complex issue, and it requires a level of community engagement that's going to be extensive. So we're working with leaders to strengthen that relationship and build that trust and have meaningful engagement. We're seeking direction and input of Aboriginal governments and organizations on policy, program, and service development and implementation. We're a partner in the Child and Family Services Trilateral Engagement Partnership, which is made up of representatives from Treaties 6, 7, and 8, Indigenous and Northern Affairs Canada, Health Canada, And this forum allows us for ongoing discussions of both common and unique issues and opportunities.
Thank you, Minister. And I think I might have time for just briefly one more question. So strategy 3.5 relates to Jordan's principle. And maybe you just can expand on that. What steps is the government taking towards adopting Jordan's principle?
Thank you. And it was actually quite exciting for me to find out that I was the government lead for Jordan's Principle. As a registered nurse for years, I had advocated to the federal government to step up and to adopt it. And certainly it is a priority for both myself and our government in terms of aligning with the UN Declaration and the TRC calls to action. So at this point, Children's Services continues to work with other ministries, First Nations leadership, and the Government of Canada to ensure that we can take steps forward.
Thank you.